Well, Doctor, I find myself talking about the pandemic in past tense all the time. Are we still in a pandemic?
Technically and practically, we are still in a pandemic. I mean, I think the confusion arises from the fact that when you compare where we were, let's say, a year ago at this time when we were first starting to feel the impact of the Omicron wave, we were having in the United States anywhere between 800,000 and 900,000 cases per day and over 3,000 deaths per day. We are down now to 300 or less deaths per day and many, many fewer hospitalizations. So we're doing much better. But if you look at it in a vacuum, 300 to 350 deaths per day is not where we want to be. We have the challenge of the upcoming colder months of the late fall and early winter, the holiday season coming, variants that tend to continue to take over, from BA.4, 5. Now we have other variants, a low uptake of vaccines, particularly a disappointing percentage of people who have gotten the new updated BA.4, 5 booster. So no, we're not out of it completely at all. We're much better off, but we're not out of it.
You mentioned the uptake on this latest booster has been disappointing. Has it been a failure?
It's not been to the level where we would like to see it. We really want to get people to appreciate, and it's understandable how people are confused. First of all, everybody has that emotional response. They want this pandemic behind them, even though the ones that have been vaccinated still feel enough is enough. Well, right now where we are, enough is not enough. You still have to keep updated, because if you look at the data, Lester, on people who are unvaccinated compared to those who are vaccinated and updated on their booster, the difference of hospitalizations and deaths in the unvaccinated to those who are vaccinated and updated is strikingly different.
Has your message become white noise to a lot of Americans? Get your boosters and you'll have an easier time if you get it. When you look at the numbers of people who are getting the boosters, for example, do you worry that this is all just white noise?
Well, I worry because I know human nature, Lester, and I know people are tired of this. They want it behind them, particularly people who have already been vaccinated or who have already been infected. They generally don't want to be hearing about this. They want to go on with their lives. And everybody wants us to go on with our lives. But we still have a degree of disease burden and death that we want to get to a much, much lower level. And we're not there yet.
Your job, obviously, primarily a scientist, but you're a communicator as well. You have been the message carrier in all this. Have you done a good job at it?
I think that's for others to judge. I can tell you I've certainly tried my best to give information based on the data as it's available at the time. I think one of the confusing things, understandably, of the public is that when you're dealing with an evolving situation like an outbreak, things change. So what happens is that people listen to public health officials, and as new data come, sometimes the recommendations and the interpretations change, appropriately so, because it is not a static situation. That clearly can be interpreted as, well, they're flip-flopping. They told us something in January, and now they're telling us something a little bit different.
Right, they told us to follow the science, but sometimes the science was taking us down the wrong road.
To give a simple explanation of this, in January of 2020, 2 + 2 = 4. In December of 2022, 2 + 2 still equals 4. But the virus in January of 2020 is a bit different than the virus that we're dealing with right now. So even though the science is following and giving you the data are changing. That's what we mean by following the science. Science is the vehicle to get you the information and the evidence that you need to make recommendations, to make guidelines. But it is changing. And I guess we need to do maybe a better job of explaining to the public the dynamic nature of this outbreak, that it isn't static from one month to the other, that things do evolve. And if you want to keep up with the best practices, you've got to keep up with the most recent information.
Did the politics of this slow down the response in a measurable way in terms of the number of people who could have been saved?
I think so. And one of the things that's very disturbing to me as a scientist, as a physician who cares about and cares for patients, both individual patients and the general public, is that the degree of divisiveness in this country right now has really led to such a polarization that it has interfered with an adequate science-based public health response. It just is unconscionable that you have a life-saving intervention in the form of a vaccine that you know is safe and highly effective in protecting you from advanced disease. And you have people and groups of people who don't get vaccinated based on political ideology. I mean, it's just extraordinary that you have under-vaccination in red states and good levels of vaccination in blue states, which gets translated into a disproportionate amount of suffering and death among Republicans compared to Democrats. That's completely crazy. You don't want to see anybody get sick, suffer, and die from this. I mean, differences in ideology are healthy. It's part of our democracy, part of what makes our country great. But when they get so extreme that it prevents you from doing something that's life-saving, that is really awful.
You've seen the face of disease up close. You've been able to peek around the corner as to what may come. If we knew what you know about disease, would any of us sleep at night?
Oh, yeah.
It's not that scary?
No. Well, it's scary if you don't have the wherewithal and you're not preparing and you don't have the capability of responding. But if you know what you have to do to both prepare as well as to respond, it isn't scary to the tune of interrupting your normal function. I mean, an example of that is the scientific effort that was put in for decades to help to develop the highly successful vaccines that we now have for COVID. That didn't happen overnight. We're making investments now in research to be able to respond to the next outbreak, pandemic preparedness plans. So if you do that and you do that correctly and diligently, you shouldn't be losing sleep at night.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.